conclusion of this really very exciting new study is that thimerosal, the ethyl mercury preservative used in vaccines prior to 2000, is not associated with an increased risk of autism. In fact, children who have the recommended vaccines got slightly more thimerosal and had less autism than children who received a lesser dosage. It supports prior findings that all of the literature to date would indicate that vaccines are not associated with autism. And this really very, very well done study looked at children in a case control method. What that means is they identified children with autism, and then they picked, for every one child with autism, 3 children who didn't have it, who were of the same age and gender in the same managed care organization, and looked at the factors related to exposure to thimerosal in both groups, and they found that children with autism did not have increased rate of thimerosal exposure. And what we certainly can say is that the prevalence of autism has continued to rise after thimerosal has been taken out of the childhood vaccines in the United States. And I also would say, as a pediatrician, that it is important for parents to protect their children with and without autism from vaccine-preventable illness. And this is especially important as we go into the winter season with concern about both influenza and pertussis, or whooping cough. So in the interest of providing appropriate medical care for children with autism, we would encourage families to make certain that their vaccines are current as well.